This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance, produced by Modern Practice Solutions. My name is Olivia Wann. In today's episode, we are speaking with our compliance trainer, Denison, about chemical dependency, an important and often required CE topic. So Caitlin, talk to us about chemical dependency and thoughts of why this is a required CE topic.
So chemical dependency might at first seem like it's not particularly related to the dental office, but when you think about it, we see patients from all walks of life, and it's possible that we may encounter a patient suffering with chemical dependency, also known as substance abuse disorder. We might be one of the only healthcare providers that our patients see regularly. They may come in for their dental appointments, but maybe they don't go see their general practitioner very often. So it's really important that we are here for our patients to provide resources and listen empathetically. And there are also some ways that substance abuse can impact the care that we provide to our patients. And this is why in many states, a chemical dependency CE is a requirement for a variety of different dental licenses.
You know, Caitlin, I remember years ago when I was a licensed registered dental assistant having to be mindful of satisfying the chemical dependency requirement here in Tennessee. And through those years of, having to take CE courses, we had to be careful of not doing it, and then our license would not be current. Can you talk to us about the Tennessee requirements?
Yeah, so Tennessee is one of the states where all dental providers, meaning registered dental assistants, dental hygienists, and dentists, have to get 2 hours of continuing education in the area of chemical dependency each CE cycle. And again, the reason for that is we encounter patients that may have a chemical dependency disorder and should be there to help our patients. Providers who can prescribe controlled substances also need to be aware of the DEA MATE Act requirement, which is a one-time 8-hour CE requirement in the area of prescription of controlled substances.
So what's the difference, Caitlin, between the hygienist or dental assistant requirement of chemical dependency and the dentist requirement having to do with opioid prescribing? What's the difference in those CE classes?
So a CE on the prescription of opioids is going to focus more on your state and federal regulations for how you can and cannot prescribe controlled substances. These requirements are both federal and state mandated. Some examples of these requirements would be the duration of prescription you're allowed to provide for a patient for acute pain. Some states also require that you review their prescription drug monitoring database and fulfill other requirements prior to the prescription of these medications. Of course, for dental assistants and dental hygienists, we cannot prescribe controlled substances. So we tend to focus more on chemical dependence and understanding substance abuse addiction as a disease and the various substances of abuse.
So Terri, talk to us about Modern Practice Solutions and how we've been offering this as both a CE course for seminar as well as video training.
Modern Practice Solution has been providing continuing education for chemical dependency and opioid prescription writing for a number of years, and we provide that in several formats to make it fairly easy for the client to take the CE course. So we have the live version, which is always wonderful because you have a great opportunity to interact with the trainer and ask specific questions. We have the live Zoom meetings. It's easier. You don't have, you can take it at your house, you can take it at the office, but you have a live trainer there. So again, you can ask specific questions for your practice. And then we also offer the recorded version that you can take at your convenience.
That makes it easy for our clients to stay current. And Caitlin, I know you've done quite a bit of seminars lately on chemical dependency and opioid prescribing. Can you describe for our listeners how we make this available as a live program where they may want to add other required topics?
Yeah, chemical dependence and opioid prescription is a popular topic for seminars. Part of the reason is because this is a required CE. So oftentimes offices that rely on referrals from general dentists will put this on as a CE as a courtesy for some of their referring offices to help them out with that requirement. It's often coupled with our OSHA course or our HIPAA course because these are also courses that are important to review annually. And it's nice for a group to get together since we all have that same requirement.
Yes, I think it's great how these specialty practices offer it as a referral appreciation. Some of them even provide a meal for the general that refer to them, and they can knock out some of the required CE. And we know that chemical dependency is a dry topic, right, Caitlin? I mean, it's dry material, but it has to be done. And we focus on what are the guidelines, you know, what are we hearing from CDC? What are the statistics? And not only is it a concern for the patients that we identify that may be suffering with chemical dependency, but Caitlin, what about our fellow dental professionals?
Yeah, substance abuse is certainly an issue among professionals. And in fact, it's particularly prevalent among dentists. While the instance of substance abuse among the general population is about 10 to 12%, it's about 12 to 19% among dentists.
Why? Why is that?
Yeah, so reasons include just the general stress of being a dental provider, particularly a dentist. A lot of the weight of the practice falls on you, and you're essentially required to be perfect every day, provide a perfect pain-free restoration each time you show up at the office, which is really stressful. And that stress also falls on some of our other dental providers, like our assistants and hygienists as well. It's a high pressure field.
And what program is available in Tennessee for those that are chemically dependent?
Lots of states have programs that allow professionals who are suffering with substance abuse issues to receive help from the organization that oversees their profession. So in Tennessee, the Board of Dentistry has a peer assistance program through the Wellness Committee. And this program allows referrals to be made confidentially to the peer assistance program if you know of a dentist or other dental professional who might be in danger. If the practitioner is willing to undergo an evaluation to determine the extent of their substance abuse problem and any treatment they need, the identity of that practitioner is kept confidential from the Board of Dentistry as long as the practitioner remains compliant with the treatment program. So essentially, the practitioner is able to get assistance for their addiction while avoiding potential legal action from the board.
Thanks for sharing that. Terri, would you talk to our listeners about the prescription monitoring database? I know Caitlin had mentioned it, but how valuable is this to providers?
It's a valuable link, and it provides the provider with a history of prescriptions that the patient has taken or has been prescribed. So the database is imperative for the dentist or the provider to see the history of the narcotic prescriptions that the patient has received in the past. You might see a pattern where they're going from Dr. A and getting a prescription, and 7 days later they're going to Dr. B, and then they're going to bounce back, and next thing you know, they're going to go see the emergency room to try and get some prescriptions. So if you log on to the database and you see that the patient has had multiple prescriptions from multiple providers, then you are obligated to report that person and also not to write them a prescription.
Correct. So it's really invaluable. Thank you for sharing that information. And Caitlin, what other thoughts do you have to share with our listeners about the chemical dependency?
I think it's important just to be aware of how the substance abuse epidemic is affecting your locality and what to be on the lookout for in your patients. This epidemic has hit all states with a variety of severity, and it's important to understand what's going on in our community. What are the substances that are affecting our community? And then once you know that, you're able to find resources that might be particularly useful to your patients. Do you have for example, a treatment center near you? Is there government funded treatment options in the area? Are these resources that you can have on hand for your patients? I think these are all good things to know and be aware of before you run into a patient who might need resources.
And I have had client support calls where a clinician has denied prescribing opioids because they felt that Tylenol and ibuprofen, especially when you rotate the two, was effective adequately, and the patient is upset and screaming and retaliating and making bad reviews on the dentist. So wouldn't you think that it requires advanced preparation of communication, suggested communication that we could use, having everyone on the same page about opioid prescribing? Because I can tell you this, you can get a reputation for prescribing opioids, and then that's what's coming in the door. And if word gets out that you're not prescribing opioids, then you won't be attracting those patients. Would you agree, Caitlin?
Yeah, and that's one reason it's so important to be aware of guidelines like the CDC's guidelines for the prescription of opioids for pain, so that practitioners are all on the same page about when we should provide opioids or other controlled substances, and when something like you mentioned, Tylenol and ibuprofen is going to be sufficient. And also to be able to educate our patients, we're not ignoring your pain. We still want to treat your pain. We just want to do it in the safest way possible, making sure patients understand that even if you're not receiving the medication you thought you would receive, your pain is still being addressed, and trying to avoid the issue of drug seeking altogether, although that's not always possible.
And that's a good point you made, because CDC does make that clear that we have to weigh the risk out of prescribing an opioid to a patient that is warranted versus the risk of potential drug abuse. And the numbers are there to support how just taking a limited number of tablets can throw someone into an addiction. So I think this is a great topic, and I appreciate, Caitlin, how you have taken the lead in doing a lot of these seminars with our clients and helping them satisfy CE. Thank you, Terri, also for joining us. Terri has worked with Modern Practice Solutions for so many years and have helped clients stay up to date on their CE requirements. So we appreciate our listeners tuning in to In Step with Compliance, produced by Modern Practice Solutions, and we'll be happy to provide resources in the show notes. Be sure to visit our website, modernpracticesolutions.com, if you are interested in taking an online CE course to satisfy requirements. Thanks again, and we'll see you next week.